for residents with dementia can be extremely stressful. Hi, I'm Kathy Getrist, and today we're going to be talking about the stress that's caused by caring for folks with dementia and some of the strategies that you can use to overcome that. The term dementia refers to any disorder of the brain that causes deficits in thinking, memory, and judgment. You're going to be caring for many residents who have dementia, regardless of whether you work in a hospital, in a long-term care facility, or in the home. Dementia is not a disease in itself, but it's a group of symptoms that are seen in a variety of diseases. Probably the most common disease that you're familiar with dementia is in Alzheimer's disease. There are many causes of stress when caring for residents with dementia. I'm just going to cover a few of them. One of the bigger ones is that we have to anticipate the needs of the individual 24/7. These folks are unable to care for themselves, and so it is total responsibility. This is particularly difficult for caregivers that are working with dementia family members in the home. Also, they continue to deteriorate regardless of how good the health care is for them. Alzheimer's dementia is a progressive disease, and they will continually get worse. My mother is in the first stages of Alzheimer's, and it's an example is in regard to her taking care of her own checking account. In the beginning, I was able to assist her to do that activity, and now it has progressed. Even though I worked very diligently with her, she's now no longer able to pay any of the bills. They just sit there and pile up, get phone calls that things have not been paid. So that responsibility has been removed from her. Families and staff continually mourn the loss of the person's abilities. People that have been very capable earlier in their lives, it is very hard to watch someone lose those abilities over time. The behavior of residents with dementia is unpredictable. It feels as if we have no control. You can go in the beginning of your shift, say good morning, have the resident give you a hug and a smile, walk out to get a washcloth or some towels to come back and care for them, return, and they may be very belligerent, may strike out at you. So it's very unpredictable from moment to moment how the individual is going to respond. It's hard to get away from people with dementia. This, again, is one that is particularly an issue when caring for someone with dementia in the home. Lots of times these folks will follow the caregiver around, whether it's very much like a small child follows their mother around, or a little puppy that follows someone around. That can get to be very stressful to have someone constantly following behind you. Communication loss is also a source of stress. It becomes much more difficult for them to say what it is that they want to say, and more difficult for them to understand. Residents with dementia do not understand logic and reasoning, so giving explanation for things becomes useless. It's better just to use simple commands and certainly never argue with these folks. Another source of stress is that you cannot show your frustration or lose your temper or say what you sometimes would like to say. An example comes to my mind. A resident said to me in the course of a few minutes, probably 6-7 times, "What time is lunch today?" Rather than saying, "You know, I have told you 6 times that lunch is at 12 noon, which would be totally inappropriate, you'd need to say each and every time, "Lunch today is at 12 noon, as though it were the very first time that question had been asked. But certainly that's a source of frustration. As I mentioned earlier, in some situations, the family is caring for the individual with dementia in the home. Whether you are working in long-term care or in a home setting, the challenges are always present. Each family is able to cope with these challenges in different ways, some more effective than others. Just some of the sources of challenge can be the financial burden that's placed on family. These folks are frequently taking a lot of medication that are costly. They also may have some other illnesses that go along with it, heart disease and such. And sometimes family members want to get away and will put the individual in a respite weekend program, or they may have them go to an adult daycare 2, 3, 4 times a week so that the family members can have a rest from it. These facilities that care for individuals with dementia on a short-term basis are extremely expensive. Decision-making by family caregivers may be based on promises that were made earlier on. One thing I tell people is never promise that you will ever, never, ever put their loved one in a nursing home, because it's very difficult to know whether or not you can really keep that promise. A friend of mine, his parents decided early on that in exchange for care in the home, they would provide their daughter and son-in-law their home. And so they purchased a home for the daughter and son-in-law, and the daughter dutifully cared for the elder parents. The mother died, but the father continued to live to be 101 years old, and then when he was in his 90s, the daughter reluctantly had to place him into a long-term care facility because she, even though had promised that she would never do that, was unable to care for him by herself any longer. The unpredictable behavior is also a challenge in a home. Sometimes these individuals with dementia do socially unacceptable things. Examples might be using profane language, especially folks that have never uttered a profane word in their lives before. Sometimes they will shoplift. Sometimes they may leave the home and go out to the mailbox with not one piece of clothing on to get the mail. Obviously all socially unacceptable and a challenge for family. Another challenge can be the change in role in family members. The parent becomes the child, and the child takes on the role of the parent. Also, there can be legal issues that can be challenging. In another lesson, we talk about the power of attorney for health care, where somebody is chosen as the agent for an elder who becomes incapacitated to make decisions regarding the use of feeding tubes or other artificial life-sustaining measures. So it's a real challenge for those that are caring for them. Emotions experienced by caregivers can be really varied, but some of them are the fear of unpredictability, as I talked about earlier, frustration with the demented individual. Sometimes they will hoard food, may refuse to be bathed, and those things can be very frustrating when you have a number of people that you're trying to care for. Anger, maybe the individual does something unsafe, turns on the stove in the middle of the night, can be very frustrating and cause anger. Rummaging through closets and cupboards and drawers and taking everything out and laying it all over the place can be a source of anger. Guilt by the caregiver for having the feelings that they have of anger and so forth. Negative feelings, it's hard to admit that those feelings are even present. Fatigue and depression can be an emotion that's experienced by caregivers due to the continual responsibility of care of these folks. And another great source of emotional stress is the grief that, as a caregiver, you experience with the decline in the person that you care so very much about. I've invited 3 individuals to come and join me in a panel discussion to talk about the sources of stress that they have experienced in caring for people with dementia, and we'll talk then about some of the strategies that they have used and continue to use to help cope with that. Please watch with me. First, I'd like to ask each of you if you could tell a little bit about yourself and what gives you the authority to speak on this subject. You want to start, Monica?
Sure. I've been a nursing assistant for 20 years now, and the last 5 years have worked in assisted living and with demented patients.
I'm new at this. I've only been doing it for about 3 years. However, I helped take care of my grandma who had Alzheimer's. My mother took care of her for 10 years. And so it gave me a caring heart for these type of people.
And I have, along with my sisters, taken care of my father for the past year. And we've experienced a lot of different things throughout that year to help him along with the disease that he has. We pretty much rearranged our lives around him so we could keep him in his home environment, so that he would, feel a lot better about his situation.
What is it that, in your experience, is so stressful, or some of the main stresses of dealing with people with dementia?
On a given day, we don't know what our residents will be like, depending on their day and their dementia. It could be a happy day, or it could be a very stressful, combative day. It depends on how the resident feels that given day.
The good thing about it is that a lot of times they can be combative, and so they can be crabby. And then it turns into a smile, and you just forget about what you just went through. Because they can be so sweet, all within a matter of minutes. You're crabby 1 minute, and they smile at you, and they love you, and they say so, and it just makes it all worth it.
And generally, the care for them, it's something that from day to day, you're doing a lot more one day and a lot less the next. I remember the episodes of clean clothes versus dirty clothes, and that challenge of making sure that that's taken care of for them.
What would you consider of the stresses that you've experienced? What would be considered some of the biggest ones, the biggest challenges that you see in caring for these folks?
Incontinence can be a problem, and bowel movements can be a major problem. You can just walk in and it's everywhere, or all over the bed. It's just one of those things that you learn to handle. It goes away. Just clean it up. But it's also frustrating for them and stressful because they know they're doing this and they have no control over it. And they just feel like, a lot of times I think they feel like we are taking care of them, and that's hard for them to admit that we have to take care of these people even themselves, because we are usually much younger than they are. And so it's hard for them to admit that we have to care for these people, for them.
I was just thinking, mealtime can be very frustrating also. The not wanting to eat, or saying, I've already eaten, and they don't remember that they haven't had their meal. Or still being hungry after having had a full meal, and they start rummaging for things to eat, and so those kinds of things can make a day real frustrating.
I think you'd mentioned also, Monica, about their modesty and bathing.
Modesty and bathing, taking your clothes off, having to be in water. A lot of people with dementia are just afraid of water. And as you and I, we wouldn't want to be undressed by someone else that we don't recognize. It can be very stressful for them and for the caregiver to have to do that. To have to undress someone that you don't know, and to do it so that they aren't embarrassed. There's just a real stress between both people.
Chances are they've never been seen naked by anybody but their mate, so to speak. So it's hard. You have to be very sensitive to that when you're taking care of them.
Okay. Charles?
And sometimes it's hard on the caregiver too. Is in our case, it was my father and some of my sisters had difficulties in overcoming that they had to do different things now, and it's overcoming. You have to be creative, so you don't wind up causing more confusion, and you have to repeat things and make sure that they're taken care of that way, that they're not frustrated.
You had mentioned earlier about your sisters having to do personal cares with your father, like getting over the barrier of their having to provide cares that usually children don't do for their parents.
Right, because I have a couple of my sisters, they've taken care of other people, but when it came to taking care of their own father, it was a little different experience. So those are the type of things that you have to overcome. And in his case, it was a little bit easier to do, because he was a little resistant in the very beginning, but it just got better and better as we went along. But you take on a different role, and when you take on a different role, sometimes it's just hard to adjust, and they made the adjustment.
Given all the stresses of dealing with patients with dementia, I'd like to ask you, what do you do for yourself to help cope with these folks?
Being able to share some of the frustration with other staff members. If you're with a resident and they're argumentative or combative, we can always step away and have someone else step in. So it's nice to have other staff members to share that with.
Sometimes you just have, for some reason that day, they're just really not liking you very much. So if you just step out and somebody steps in, I mean, that works too sometimes, Just for some reason that day, they're not their favorite.
And in our case, it was prayer. Prayer helps a lot.
Absolutely.
You can't you can't overrate it. You have to learn that this is something that they cannot control. Their judgment is impaired, and you're going to have to help them along with that. So.
And I would say a good sense of humor, laughter when appropriate.
Right.
Oh, heck, cry when appropriate.
Yeah, and we do that too.
We do a lot of that too.
Yeah.
And having patience.
You mentioned a little bit about families. Is that a source of stress for you as
Well,
caregivers?
it can be a source of strength, and it can be a source of stress, depending on the family and their understanding of their loved one's disease. If they have good knowledge and that makes it easier for us to work with them. If they're in denial of where their loved one is at as far as their dementia, then sometimes it's quite difficult to provide the kind of cares that we would like to provide.
Sometimes it's hard for them to admit that their parents need this type of care and that they're slipping away from them before their very eyes.
I think, Charles, you mentioned something about another thing that you can do for yourself. You mentioned earlier the getting education and the support groups. Do you want to talk about that a little bit, how that might have helped?
Sure. I've gotten information off of the internet. There are books out there and pamphlets out there, focus groups, and you have to share with other people who have the same type of problem, because you're going to gain more and more knowledge. And the other part of it too is you're going to have to enjoy the time that you have, because this is a destructive disease, and you need to get as much information as you possibly can.
Okay. What organization did you work with, if any, to help you in the home situation?
My main source was from the Alzheimer's Association, and they sent out pamphlets. And I still receive information from them, even though my father has passed on. I still receive information, and they were very instrumental in me passing it on to my sisters and having them get more knowledge and make it a lot easier to go through everything that we had gone through with my father.
Okay. Why do you work with these people? There's lots of different patients that you could choose to work with, but for those of you that are in a caregiving situation in an institution, is it your choice to work with people with dementia, and why do you like working with them?
Well, I think it definitely has to be a choice. You have to want to care for people with dementia.
My theory is if you really don't care for these people, then you probably should get out of the business, because I think they can feel if you're not really caring with them or just putting on an act. I mean, these people can tell when you do care about them. You just need to have a caring heart and a caring spirit, and they can feel that. A lot of times they do show you love, and they do. We have a little lady that, I love you a lot, and you love you, I love you right back. But you just, the fact that they do care for you also, and that you try to make their life easier, and they know that. A lot of them know that you are caring for them. To me, that's rewarding.
The thank yous, the smiles, just being around and being able to be with them is a real gift. We're the lucky ones. We get to share their days.
And so that's one of the reasons I do it, is because I do care, and also any one of us could be there soon or down the road. And also, how would you want your parent or grandparent to be treated? So you need to treat these people with respect and care and loving them.
You had mentioned, Monica, earlier about the education that you've gained from working with these people. Is it true that you're really learning things from them?
Oh, absolutely. They hold a lot of knowledge in reminiscing. You can bring things forward from their past, learn about them as people, and then things that they may have done, and you learn a whole lot about yourself in taking care of them.
Charles, you had mentioned something about loving history and your experience with your father.
Yes. I know my father, before, he didn't talk about World War II very much, but when he started talking about different things, he told us about the Red Ball Express, which he was a participant in, and the memory is still there. It's not something that you're thinking too much about. You're thinking that it's all gone, but he'll come up with some of his experiences and pass them on to you. So it can be fun. A lot of times we have a tendency, we think it's just all work, but he passed on information to not only myself but my sisters and the rest of the family that's invaluable.
What do you do if somebody seems to be stuck in a different period of time? Let's just say they're saying that they are in the 50s and they've got small children that they need to get on the bus and they can't bother with you right now, and what do you do?
You get into their moment and say, well, let me help you. Let me help you get ready, and then together we could take care of the children, make sure that they get on their way. And simply by going through their daily routine, their morning routine, whatever it may be, and then maybe walking out of the door of their room just brings them back into reality, and that whole thought is gone, because they do change from moment to moment.
We should never tell them they're wrong, that this isn't happening. Your children are grown up. Don't ever correct them on things like that. Just go along with it, as long as they're not in danger.
So trying to get your point across, arguing?
No, never argue.
Work.
Arguing it'll never work. Or even trying to get them to understand, sometimes it won't work, because they're not a lot of times on the same level.
There are special characteristics, I'm sure, for dealing with these individuals, I'm wondering what you consider would be some of those characteristics.
You need to be loving, patient, caring. You need just really to care about these people and have respect for them. Even though even mentality may be lower than yours, they're still older and they have earned respect and deserve it. So you always should show them respect and love and care. And their emotions, too, are so real. I mean, if they're distraught over something that to you seems so irrelevant, they truly are distraught over it. You know, we are not one to judge that at all.
Finally, I'd like you to share with the folks watching this what advice you could give them as they start this new profession. How best to deal with these folks with dementia?
I think that you have to remember that they are people, and they're people with a past and with memories and with feelings, and you just have to be aware of all of that and care for them like you would care for one of your loved ones.
Yes. Never put them down for anything that they're doing or have done. Yeah.
Do you think that everybody is able to learn to deal with patients with dementia?
Oh no, I think you have to be a caring person.
Okay.
Yes, definitely. You have to love these people.
Okay.
And you've got to take it beyond just the occasional care. I mean, you have to really want to make sure everything is working well for them. This is the first time. You have to remember this is the first time for them going through this, and it's the first time for you and the first time for them. So if you keep that in mind, you're going to be in a lot better position to help them and help yourself.
So you're learning together.
Exactly.
Well, thank you very much, all three of you, for sharing your thoughts today.
Thank you.
Thank you.
It's our privilege.